Me again. I know you're all tired. It's been a long day. I'm going to be quick, finish fast, so all can go home. So this topic is about antibiotic prophylaxis. We all know about antibiotic. For decades, it is the first enemy for orthopedic bacteria. It's been there for decades, and they will stay after our death. So we need to respect them. We need to treat them properly. Okay, so let's go. And for this nice guidelines, they recommend to give one single dose IV at induction and then followed by post-prophylactic doses, either cefuroxime or fluoxetine, and if they are positive, we're going to give teicoplanin. Why we say let's do this project? So what we found is our patients, they are missing doses of post-op antibiotics. And when we did a quick questionnaire between junior doctors, most of them, they were unaware of the KGH policy, which is our hospital policy. They will just prescribe what the anesthetist did in the anesthetist sheet. And the anesthetist, he doesn't follow up. He give whatever his experience. He doesn't follow the proper policy. So what we want to do is to make a proper guidelines, a proper thing to follow in our hospital, making the anesthetist and our team to prescribe. What we did is a retrospective. We saw the patient that admitted in our hospital in between March and June 2022, and we used our internal hospital system to collect the data. So what we found out of 101 patients, there is, can you see a virus antibiotic given? It's not one or two. Some of them, they are giving cefuroxime, some of Tyke and Gent, some only Tyke, and some of them receiving only Comox. And what the result is, 76 patients, they receive the post-operative coverage. The other around 24 patients missed their post-operative doses. And if we see what antibiotic they received, 90% they received on teicoplanin, other patients received cefuroxime, and other patients received Comox. So what we found in this study is around 24 of our patients missing their post-operative doses. And we found there's a varying degrees of antibiotic regime giving to our patients. The difference between Tyco and Gentle, cefuroxime and Comox. There is no standard to follow. And the prescriptions in theater, they will be in theater sheet, and the patient will go back to the ward. It will be missed because of the paper-based. So there will be some type of communication gaps, and that's what we want to avoid. And in our hospital, we are heading to paperless, so anything will be on the systems. How did we fix it? So we had a discussion and we sat down with microbiology, with our consultant. We need proper guidelines to do for neck of femur fractures and other thing with elective total hip replacement. So we sat down, we said, okay, for teicoplanin, we need to give Tycongent, and for elective total hip replacement, we're going to give cefuroxime. And what we need to do to avoid postoperative missing doses, we encourage the operating team, the surgeon who was in theater, when he finished, he need to go out and prescribe on the system, rather than writing in the post-op notes and leaving to the ward doctor to prescribe it, which is usually get missed, especially the patient that are returning afternoon, after 4 and 5. So that's the policy that we introduced in our system. Either trauma or elective patients. The trauma patients will give Tycongent and followed by 1 dose teicoplanin. Elective cases, we give cefuroxime and 2 more doses Cef post-op. That's the poster we did. We put it in all theaters, in the doctor office, in the anesthetist room, make them all aware. And surprisingly, even in ED, they printed and put it there. I don't know why. So what is the message of this project? These little things like writing on the post-op can be easily missed because of paperwork, and as such as they just don't see the patient after the theater, they will go home and result in missing doses. Next day, they will continue as the same. So there is a communication gap. That's what we need to address. That's why we are moving away from papers. Everything is changing to the system electronically on EPMA prescribed. Other thing, we need to respect bacteria. Bacteria, when bone healing process, they will give a lot of blood flow, a good environment for bacteria to grow in. So we need to respect them. We need to give them appropriate treatment, appropriate antibiotic. And at last, we need to make sure that the surgeons, after finishing the operation, they don't just sit and write the post-op notes and go. They just want to prescribe the post-op antibiotic, and that's done. And surprisingly, in the second cycle, we finished it and presented last Friday. We improved the post-op antibiotic from 24 to 9%. That's good. The thing that patients are missing the post-op on strike, junior strike days and on the weekends. So there are still, because on the weekends, it's mostly seniors who prescribe and operate. So still there are some patients missing antibiotics because of seniors. So we need to make sure the seniors prescribe the post-op antibiotics. Any questions?